Hi, Dr. James here, clinical nutritionist, clinical herbalist, and also psychotherapist. Ladies, how long does it take before a diabetic may go blind or lose a limb? Let's talk about that for a moment. Now, I'm not saying that that's going to happen to you if you're a diabetic, but you should know the data about this. Now, normally it takes 10 years of exposure to high blood sugar before you see some pretty serious complications to your nervous system and also to your eyes. You start developing infections to the kidneys and even the brain with loss of memory. Now, some complications are numbness in the fingertips and also in the toes. Now, you can get infections anywhere because it lowers your immune system. Now, your kidneys start leaking protein because of the destruction of the kidney. And then the nerves of the eyes get destroyed. And the way it works is like this. Higher level of glucose combined with proteins in your tissue, and they create this situation called glycated proteins, which I'm not going to get into today, because basically what it is that it makes protein sticky and starts clogging up the vascular system, especially to the nervous system. So the nerves in the eye, like the retina, is fed through the vascular system. So if the blood vessels to the nerve can't flow blood anymore, the nerves die, and that is what causes the diabetic to go blind. Now, it's called diabetic retinopathy. So there are certain tissues in your body that are influenced with the high sugars more than others. The eyes are at the top of the list. The nerves are affected. The arteries and inside the vascular system is affected, and that's why it affects the heart. So when your blood sugars are over 200 or your A1C is over 8, that's the type of high blood sugar exposure that I'm basically talking about. Because normally, a normal fasting blood glucose is between 70 and 90. A pre-diabetic is anywhere around 100 to 125. And then a diabetic diagnosis is probably over 125. All right, so here's the problem. You go to the doctor, and the main focus is to keep your blood sugar within a normal range using medication, right? Here's my question. My question is, if you're taking the sugar out of the blood by using medication, where is the sugar going? Is it just evaporating? Is it disappearing? I don't think so. See, you're basically shoving the sugar into other places in the body. You're creating other problems, so you're switching one problem by lowering blood sugar with medication for another problem. So that blood sugar is now being crammed into other places. It's going into the liver. It's going around organs as visceral fat. It's going inside the organs and creating damage. And these problems are not even addressed most of the time. Well, basically, they're not addressed. The other thing is this, that is not addressed, is high levels of insulin that you have with the type 2 diabetes. Now, type 1 diabetes is not enough insulin. Type 2 diabetes is a serious problem with insulin resistance, where you have high levels of insulin. But the doctor never checks the high levels of insulin. He never checks that. They're checking the blood glucose. Now, here's my point that I want to bring up to you. And that is that high levels of insulin is just as damaging, if not more, than high levels of blood glucose. Now, this is why your body develops insulin resistance, because it doesn't want all that insulin in your body. So it actually creates a situation where the receptors don't absorb the insulin in the cell anymore as a protective mechanism. And it's going to be really hard, if not impossible, to ever crack this problem unless, number one, you get the amount of carbohydrates out of your diet. Now, all right, so the question is, that will come up probably, and you may have for me, is what if you already have begun to have blindness, or you have come into a place of blindness or gangrene? Can you reverse it? Is it possible? possibly, it's possible to reverse it. Now, what do you need to do? Well, you need to deworm first. You also need to go on an all-fruit diet. And then you need to get the diabetes kit from my office to reverse this diagnosis of diabetes. Now, let's work together. Let's be a team. Ladies, listen to me. I'm your team player. I'm on your side. And we're going to work together because we're going to get rid of this diagnosis of diabetes. And it's very possible to do that. I'm going to also say this. I don't believe that there's anything that's impossible. Your body is built to heal. God made it that way. That is able to heal. And we're going to work towards the healing. Here's what I want you to do. I want you to call my office at 240-383-4800. Now, I presented you with a problem, but I've also presented you with an answer. So call the office at 240-383-4800. Ladies, get ready to heal from diabetes and also diabetic retinopathy. It's going to happen. You can do it. I'm rooting for you. I'm your team player. Talk to you soon.